Hello everyone, Dr. Mandell here. Today we're talking about something many people consider a superfood: seeds, chia seeds, flax seeds, sesame, sunflower, pumpkin. They're packed with nutrients. They support the heart, the brain, the digestive system. But if you're over 55, there's a hidden danger no one is talking about, and it can dramatically increase your stroke risk if you're not aware of it. My goal today is simple: to help you understand the benefits, the science, and the right way to use these seeds safely, especially as we age. Most people look at a tiny seed and see nothing more than a sprinkle of health, a garnish, a topping, a nutrient booster. But inside that speck of nature lies a story far more powerful, far more complex, and far more misunderstood than most people realize. Seeds are among the most ancient foods on Earth, engineered by evolution to protect life itself. Packed tightly inside their shells is everything a new plant needs to survive: energy, oils, minerals, proteins, and compounds designed to keep danger away. And for decades, nutrition science has praised seeds as the ultimate superfood. But hidden behind that praise is a truth we rarely talk about, a truth that becomes especially important for the aging body. Because while seeds can bring life, the wrong use at the wrong time in the wrong digestive system can bring harm. Most people don't know that the same seeds marketed as heart healthy or stroke preventing contain compounds that the human digestive system must work extremely hard to break down. Chia seeds can absorb up to 10-12 times their weight in water. Flax seeds contain tough outer shells that resist stomach acid. Sesame seeds can pass through the intestines almost intact. These properties make them powerful, but also potentially problematic when digestion slows with age. And digestion does slow with age. After 55, stomach acid production drops significantly. This means food doesn't break apart as easily. Transit time slows, constipation becomes more common, and the older intestinal tract becomes more vulnerable to obstruction, dehydration, and irritation. Yet every day, millions of seniors are told, add more fiber, eat more seeds. What they're not told is that whole seeds behave differently inside the aging gut. Take chia seeds, tiny, smooth, seemingly harmless. In water, they expand into a gel, swelling dramatically in size. But when swallowed dry or mixed into foods without enough liquid, they can begin absorbing water inside the esophagus or intestines. Case reports in medical literature describe older adults arriving in emergency rooms with gelled chia masses lodged in the throat or forming thick blockages in the intestines. These obstructions are excruciating, dangerous, and entirely preventable. And while rare, they reveal an important reality: the aging digestive system cannot be treated the same as a younger one. Flax seeds tell a similar story. Whole flax seeds are nearly impossible for the body to break down. They pass through untouched, offering little benefit and sometimes causing irritation in people with diverticulosis, a common condition where small pouches form in the colon. But when ground, flax seeds become one of the most powerful plant-based omega-3 sources known to science. The difference between benefit and harm is not the seed, but the form it's eaten in. And then there are the interactions no one talks about. Many seeds contain natural lignans and mild anticoagulant properties, not dangerous for most people, but potentially concerning for older adults on blood-thinning medications. Chia and flax can slightly influence how quickly blood clots. Combine that with warfarin, aspirin, Eliquis, or Plavix, and the body can become more sensitive to bruising, bleeding gums, or nosebleeds. None of this means seeds are bad. It simply means the aging body must navigate them differently. Yet, the emotional heart of this story lies not in the seeds themselves, but in the assumptions we make about health. We assume that healthy foods are safe for everyone. We assume that natural means harmless. We assume that what benefits a 30-year-old also benefits a 70-year-old. But the aging body is not a younger body. It is wiser, but more delicate. resilient but less forgiving, demanding but deserving of respect. You see, seeds are concentrated life. They are dense, powerful, and biochemically active. Their oils influence inflammation pathways. Their fibers affect gut motility and hydration levels. Their minerals interact with medications. They are not passive foods. They are dynamic biological tools, and tools must be used correctly. Scientific research shows that seniors experience significantly higher rates of dehydration. Combine this with dry seeds, and the digestive tract is forced to pull water inward, leaving the bloodstream even more concentrated. Thickened blood is harder for the heart to pump. It strains the vessels. It increases workload. And for someone with hypertension or heart disease, even small shifts in hydration can have large physiological effects. No one warns them. No one explains the nuance. No one says, this healthy habit might not be healthy for you. Instead, the message is simple and universal. Seeds are good. But the truth is more precise. Seeds are good when used properly, because seeds are powerful allies. They protect the heart, they lower inflammation, they stabilize blood sugar, they support brain health with omega-3 fatty acids, they reduce cholesterol with soluble fiber, they offer minerals many seniors are deficient in, they provide antioxidants that slow cellular aging. But every benefit depends on the body's ability to process them safely. A chia pudding soaked overnight is gentle on digestion. A handful of dry chia swallowed quickly is not. A tablespoon of ground flax mixed into oatmeal supports heart health. A spoonful of whole flax swallowed with little water can sit like gravel in the gut. A soft sprinkle of hemp or pumpkin seeds is easy on the intestines. A sudden jump from a low-fiber diet to high seed consumption can shock the system. For seniors, the question should never be, are seeds healthy? The question should be, how does my body handle them? How much water do I drink? What medications am I on? Is my digestion fast or slow? Am I introducing them gradually or all at once? This is the calm, scientific truth hidden beneath years of oversimplified health advice. Seeds are not villains. Seeds do not cause strokes. Seeds do not threaten life on their own. But seeds, when misunderstood, can become a source of digestive stress in a body that needs less stress, not more. The irony is that the very people who benefit most from the omega-3s in flax are often the ones who struggle to digest it whole. The very people who need the gentle fiber of chia are often the ones eating it dry. The very people who can gain the most from plant-based nutrition are also the ones most vulnerable to incorrect use. And that is why this story matters, because health is not about adding more. It is about adding wisely. It is about understanding the body we have, not the body we used to have. It is about using nature's gifts, not blindly, but intelligently. Seeds are powerful. Seeds are healing. Seeds are ancient medicine, but only when used with the respect they deserve and the knowledge the aging body requires. Most people have no idea how quickly the body can shift from balance to danger. Not in days, not in hours, but in seconds. One moment, everything feels normal. The next, a surge of pressure, a tightening in the chest, a sudden dizziness, and everything changes. That's how strokes often happen, suddenly, silently, without warning. And what makes this even more unsettling is that the triggers aren't always dramatic. Sometimes they begin with something as ordinary as digestion. You see, the human body is a system of delicate pressures. Blood pressure, intracranial pressure, vascular tension, hydration levels, all constantly shifting, constantly adapting. In youth, these systems rebound quickly, but with age, the rebound slows. The arteries stiffen, the heart works harder, and the gut, one of the most overlooked organs, becomes a source of stress that few people ever connect to the brain. Yet the scientific literature is clear. Constipation, dehydration, and straining during bowel movements can create abrupt spikes in blood pressure large enough to trigger cardiovascular events in vulnerable individuals. Doctors call it the Valsalva effect. You feel it when you hold your breath and push. That pressure doesn't just stay in the abdomen. It shoots straight into the arteries that feed the brain. And this is where the story of seeds takes an unexpected turn. Seeds, especially chia and flax, are praised for their fiber. But what most people don't realize is that fiber behaves like a sponge. When handled correctly, it softens waste and helps the intestines move smoothly. But when handled incorrectly, especially in an older adult who doesn't drink enough water, that same fiber can become dense, dry, compacted. It sits in the gut like a tightening knot. The body pushes harder, the pressure spikes higher, and in that moment, a healthy habit becomes a silent stressor. Scientific research shows that constipation increases systolic blood pressure dramatically during straining, sometimes by more than 70 mmHg in older adults. For someone with weakened arteries, that spike can be catastrophic. And while seeds are not the enemy, the way seeds are used becomes critical. Chia seeds, for example, are capable of absorbing up to 12 times their weight in liquid. If eaten dry or partially hydrated, they pull water from the gut, thickening stool, slowing motility, and increasing the need to strain. Now imagine an older adult who takes a daily blood pressure medication. Imagine they're slightly dehydrated, a condition affecting more than half of people over 60. Imagine they add 2 tablespoons of dry chia to a morning yogurt, thinking they're making a healthy choice. Inside the digestive tract, those seeds swell, expand, and absorb moisture. The stool becomes heavier, the intestines work harder, the urge to strain intensifies, and the heart, already working overtime, faces yet another challenge. This isn't speculation. Hospital case reports describe emergency situations where older adults develop severe esophageal or intestinal blockages after consuming chia seeds without sufficient water. While these cases are rare, they highlight a truth we cannot ignore. The body changes with age, and digestive stress doesn't stay confined to the gut. It becomes systemic. It affects the heart, the brain, and blood pressure, the very systems that strokes prey upon. And then there's dehydration, the quiet accomplice. Every year, thousands of seniors visit emergency rooms due to dehydration-related complications. The aging body loses its ability to sense thirst. Medications like diuretics pull fluid from the bloodstream. Low stomach acid slows digestion, requiring even more water to process food. And when seeds are added to the diet without increasing water intake, they draw moisture inward, away from the bloodstream. Thicker blood flows more slowly. The heart strains, the vessels constrict, and the risk of clot formation rises. Again, not because seeds are harmful, but because they interact with hydration levels in a way many older adults aren't prepared for. Now layer onto this the reality of medications. Nearly 40% of seniors take blood thinners or antiplatelet drugs: warfarin, Eliquis, Xarelto, aspirin, Plavix. These medications save lives, but they also make the body exquisitely sensitive to even small changes in bleeding and clotting behavior. Some seeds, like flax and chia, contain natural compounds that can have mild anticoagulant effects, harmless for most, but not always predictable when combined with powerful prescription drugs. It's not that seeds will cause bleeding. It's not that seeds will cause a stroke. It's that the combination of digestive stress, dehydration, medication interactions, and blood pressure spikes creates a physiological environment that demands caution. And yet, most seniors are told nothing about this. They hear that fiber prevents heart disease. They hear that seeds reduce cholesterol. They hear that omega-3s protect the brain. And all of that is true. But they are rarely told the other half of the equation, that the very thing protecting them can become a stressor if used without hydration, without moderation, without understanding. Picture this: a man in his late 60s wakes up constipated. He sits on the toilet and strains. His blood pressure surges, not gradually, but violently. His face reddens, his pulse pounds in his temples. Inside his arteries, fragile plaques tremble, and with one forceful push, the pressure becomes too much. A vessel in the brain gives way, a clot dislodges, a stroke begins. This scenario plays out more often than it should, and while seeds are not the cause, poor digestive habits, often involving fiber used incorrectly, are part of the chain. This is why we must understand the body, not fear it, not fight it, but interpret the signals it gives us, especially as the years pass. Seeds can be among the most powerful foods for longevity. They reduce inflammation, feed the gut microbiome, support heart health, stabilize blood sugar, and nourish the brain, but only when they are used in harmony with hydration, medication awareness, and the pace of an aging digestive system. The real danger is not the seed. The real danger is the assumption that all bodies digest them the same way. The real danger is ignoring the warning signs of straining, bloating, dryness, or discomfort. The real danger is forgetting that something so small can influence something so large. The cardiovascular system is not isolated. It is connected to the gut, to the brain, to the choices we make daily. And when the gut suffers, the entire body pays a price. Seeds can heal, seeds can nourish, seeds can protect, but only when used with the respect the aging body deserves. Most people think healthy eating is simple. Add this, remove that, sprinkle a little of this superfood, and suddenly you're protected from disease. But real health is not built on trends. It is built on understanding. And when it comes to seeds, the difference between benefit and risk can be as small as the seed itself, because these tiny foods, often praised as miracle ingredients, only deliver their true power when they're used correctly. And when they're not, their benefits fade and the body pays the price. The truth is that seeds are one of the most concentrated sources of nutrition on earth. Inside each one lives a blueprint of life: omega-3s to reduce inflammation, fiber to support digestion, minerals to strengthen nerves and muscles, antioxidants to shield cells from aging. But the body can only access these benefits if the seeds are prepared in a way the digestive system can actually use. And this is where the science becomes crystal clear and shockingly overlooked. Take flax seeds. Most people toss them into cereal or smoothies whole, believing they're doing something good for their heart. But whole flax seeds pass through the body nearly untouched. The National Institutes of Health confirms that the outer shell of a flax seed is resistant to stomach acid and human digestive enzymes, meaning that unless it is ground, the body absorbs almost nothing. Not the omega-3s, not the lignans, not the fiber. Imagine buying a powerful supplement only to flush it out whole. That's what millions do every single day without realizing it. But when flax seeds are ground, everything changes. Suddenly, the omega-3s become available, the same anti-inflammatory fats associated with healthier arteries, improved brain function, and better cholesterol levels. Lignans become bioactive, compounds that research suggests may help regulate hormones and combat oxidative stress. The fiber becomes usable, capable of softening stool, supporting gut motility, and even helping stabilize blood sugar. Grinding the seeds unlocks the medicine nature sealed inside. Chia seeds tell a different story. They don't need to be ground, but they must be hydrated. These tiny seeds can swell exponentially when mixed with water, forming a gel-like coating that the intestines handle smoothly. But when eaten dry, especially by older adults with slower digestion, they can expand inside the gut, pulling water inward and thickening waste. And that thickness can lead to straining, dehydration, or painful blockages. Yet when soaked properly, chia becomes one of the gentlest, most nourishing sources of fiber available. The difference comes down to one step: water. Yet most people skip it. And then there are pumpkin seeds and sunflower seeds. Easier to digest, rich in magnesium, zinc, and healthy fats, they offer crucial minerals that many seniors are deficient in. Magnesium alone supports over 300 biochemical reactions in the body, from muscle relaxation to heartbeat regulation. Yet many older adults chew these seeds poorly or eat them salted, dehydrating themselves further without realizing it. A healthy food becomes a hidden stressor simply because of how it's consumed. But perhaps the biggest mistake of all is not the form of the seed, but the pace. The aging digestive system is incredibly sensitive to sudden changes. Adding fiber too quickly, even healthy fiber, can create gas, pressure, constipation, or discomfort. Scientific studies show that increasing fiber intake without gradual progression can actually worsen digestive symptoms before improving them. Yet enthusiastic consumers often go from eating little fiber to pouring 2 tablespoons of seeds into a smoothie overnight. The gut isn't prepared, and the result is not health, but strain. Hydration becomes another piece of the puzzle. Fiber without water is like cement. It dries, it compacts, it hardens, and the intestines must push harder to move it along. For younger bodies, this may create mild discomfort, but for older adults, many of whom take water-draining medications or have reduced thirst perception, this becomes a serious issue. Research shows that even mild dehydration thickens the blood, increases blood pressure, weakens cognitive performance, and places unnecessary stress on the heart. Yet simply drinking more water can transform seeds from a digestive burden into a powerful healing ally. These are the small mistakes that add up. Grinding, soaking, hydrating, progressing slowly. These aren't optional details. They are the difference between benefit and risk. Now imagine using seeds correctly. A tablespoon of ground flax each morning, gently stirred into oatmeal, providing omega-3s that support brain health. A cup of water beside it to hydrate the fiber and help the intestines move smoothly. Chia seeds soaked overnight, forming a gel that nourishes the gut microbiome. A sprinkle of pumpkin seeds on a salad, contributing magnesium to relax blood vessels and stabilize heartbeat rhythm. Suddenly, seeds become not just food, but functional nutrition, a toolbox of protection for the aging body. And the research backs it. Ground flax has been shown in clinical studies to help reduce LDL cholesterol, the kind that narrows arteries. Chia's soluble fiber has been linked to improved blood sugar control. Pumpkin seeds provide zinc, essential for immune function, especially in older adults. Sunflower seeds supply vitamin E, a powerful antioxidant associated with reduced cellular aging. But none of these benefits matter if the seeds are eaten in a way the body can't use. The tragedy is that so many people try to do the right thing. They try to eat healthier. They try to support their hearts, their brains, their digestion, but without the right knowledge, they unintentionally create stress instead of healing. Not because they choose the wrong foods, but because they use the right foods the wrong way. That's the story few people tell. Not that seeds are dangerous, not that seeds cause disease, but that seeds require respect. Nature designs everything with intention. A seed is a protective capsule. It does not give up its nutrients easily. It must be opened, softened, hydrated, or broken down. Only then does it reveal its healing potential. And the aging body requires intention too. Gentleness, progression, hydration, awareness, because health is not an accident, it is a craft. One built on small choices, small adjustments, small habits, repeated daily. When seeds are prepared with care, they can strengthen the heart, calm inflammation, soothe digestion, and support longevity. But when rushed, ignored, or misunderstood, they become missed opportunities, nutrients the body can't access, or fiber the gut can't handle. And that is why using seeds safely is not just a recommendation, it is a responsibility to your body, to your future, and to the years still ahead.